So I am doing my project on Lyme disease and public health. So introduction. Lyme disease is a bacterial infection transferred to humans by being bitten by a black-legged tick. Symptoms include fever, fatigue, and headaches, as well as a rash called erythema migraines. Mortality is low, and most cases can be treated within a few rounds of antibiotics. If left untreated, damage can be done to the joints, heart, and nervous system. Epidemiology, prevalence and incidence. The total number of cases of Lyme disease in the United States was 89,470 in 2023. The incidence rates in the United States was 26.94 per 100,000 people, and incidence rates have increased substantially since 1996, with the prevalence rate of just 6.11 for that year. So the gender and age epidemiology. And so this is for the years 2010 to 2023. Incidence rates were higher among men than among women. Incidence rates were highest among 70 to 74-year-olds and lowest among 25 to 29-year-olds. Children below 15 are also a notably vulnerable group, with the second highest prevalence rate among rates being among ages 5 to 9. Differences in age are consistent in both men and women. Epidemiology, time and place. This is also the years 2010 to 2023. Cases of Lyme disease are more prevalent during early summer, with the highest amount of cases being reported in June and July. The highest incidence rates are reported in Connecticut, Delaware, Maine, Maryland, and Massachusetts. So Lyme disease is much more prevalent in the Northeast than it is in other parts of the country. Main causes. Lyme disease is spread through the bite of black-legged ticks infected with Borrelia burgdorferi, or in rare cases, B. mayoni. The ticks become infected through the blood of their host, generally a rodent, and location plays a big role in the probability of getting the disease. So black-legged ticks are found countrywide but those in the southeastern states are much less likely to be carriers of the disease, and that has to do with whatever they get their blood from, whether or not they are able to contract the disease. So like lizards in Texas don't get the disease, so ticks can't pick it up from them. Main causes continued. The spread of Lyme disease can be partially attributed to ecological failure. A lack of predators such as foxes and coyotes can increase Lyme disease, as this leads to an increase in rodents and thus an increase in ticks. Racial disparities in diagnosis and treatment also exist. So CDC identified Hispanics in the US as having a higher risk of exposure, yet those numbers are not reflected in their statistics, suggesting underrepresentation. And the rash symptoms of the disease are harder to identify on Black skin, and many medical students are not taught to point it out, resulting in delayed treatment, which can, is bad. Public health measures, citizen science. National Science Foundation, NSF, funded a research team studied the encroachment of ticks into human-dominated spaces. They launched a free iPhone app called the Tick app. This app allows users to report tick sightings, see where others have reported sightings, and learn how to identify ticks and protect themselves. Information gathered by civilians through the app is used to improve research on Lyme disease, like data on what kinds of urban green spaces are good for ticks and which ones are bad, as an example. So another public health measure is this plan the CDC came up with in 2024, last year. The CDC released the U.S. Health and Human Services press release on the vector-borne disease national strategy. Their goals were to better understand when, where, and how people are exposed to and get sick or die from vector-borne diseases, develop, evaluate, and improve tools, methods, and guidance to diagnose vector-borne diseases and other pathogens, develop, evaluate, and improve tools, methods, and guidance to prevent vector-borne diseases and other pathogens, develop and assess drugs and treatment strategies for vector-borne diseases, and disseminate and implement public health tools, programs, and collaborations to prevent, detect, diagnose, and respond to vector-borne disease threats. And those are my sources.